one way in which WHO is continuing to support countries with science, solidarity, and solutions. As some countries start to reopen their societies and economies, questions about how to hold gatherings of large numbers of people safely have become increasingly important. This is especially true of one of the world's largest mass gatherings, the annual Hajj pilgrimage. Earlier this week, the government of the Kingdom of Saudi Arabia announced that this year's Hajj will proceed with a limited number of pilgrims of different nationalities who live within the kingdom. This decision was made based on a risk assessment and analysis of different scenarios in accordance with WHO's guidance to protect the safety of pilgrims and minimize the risk of transmission. WHO supports this decision. We understand that it was not an easy decision to make, and we also understand it is a major disappointment for many Muslims who are looking forward to making their pilgrimage this year. This is another example of the hard choices that all countries must make to put health first. Finally, tomorrow, the government of the Democratic Republic of the Congo is planning to announce the end of the Ebola outbreak in the east of the country after almost 2 years of struggle. In total, there have been almost 3,500 cases, almost 2,300 deaths, and almost 1,200 survivors. WHO is proud to have worked under the leadership of the government of the DRC to bring this outbreak under control. This has only been possible thanks to the service and sacrifice of thousands of Congolese health workers working side by side with colleagues from WHO and many other partners. I salute them all. Many of the public health measures that have been successful in stopping Ebola are the same measures that are now essential for suppressing COVID-19. Finding every case, isolating every case, testing every case, caring for every case, and relentless contact tracing. These are the measures that must remain the backbone of the response in every country. There are no shortcuts. But Ebola and COVID-19 are only two of the health threats facing the people of DRC and many other low and middle-income countries. That's why WHO is committed to continuing to work with the people and government of DRC to strengthen its health system and support it on the road towards universal health coverage. I thank you.
Thank you, Dr. Tedros, for these opening remarks. We will open the floor for questions now. We wish to remind you, if possible, to be short and have one question per person. And again, you can ask your question in 61 languages plus Portuguese, if you wish to do so. We will start with Peter Kenny.